Hello, I will be measuring my patient's or my individual's vital signs. So these are the vital signs that I will be measuring. The first one is the body temperature. Next is the pulse rate. Next would be the respiration rate. And lastly will be the blood pressure. This is actually very important because the result of these vitals will determine the treatment and protocols to follow in order to make a decision to help our patient. So make sure at the end of every measurement or at the end of these four measurements or the vital signs, we will be informing the patients of the results. I hope you enjoy. Thank you. Okay, this is how to take the body temperature. So make sure that your hands are washed and the thermometer is sterilized. So how to clean your thermometer? Use a cotton ball with alcohol and clean it from the sensor to the stem. Next, you're going to place the thermometer in the armpit, which is the axillary, and make sure to turn on the button, sorry. So after putting on or in the armpit area or the axillary, we will wait for the beeping sound, which indicates that the reading is complete. And this time we have to make sure that we have a record sheet or a paper or a notebook to be able to write down the results. Make sure to document the temperature. This includes the date, time, and method used as, like for example, A for axillary. So we use our armpit or axillary, so we'll just have to put A. Next is, so after using, we make sure that we sterilize the thermometer again. So this time we wipe from the stem to the sensor tip. This is after we use the thermometer. So let it dry before returning it to the container. Next is taking the pulse rate. So you have to make sure to wash your hands before touching anything or your patient. So make sure that the individual is at rest before we begin. And then the easiest place to find a pulse to measure is the radial artery found in the inside of the wrist closest to the thumb. You can also find pulse inside the elbow, which is the brachial artery, behind the knee, which is the popliteal artery, or the neck, which is the carotid artery. So first and second fingertip, you will be using that to press firmly but gently on the wrist until you feel a pulse. With an analog clock or watch, wait until the second hand is on the 12 and then begin counting the beats of the pulse. So you can start counting until 60 seconds. When counting, do not watch the clock continuously, but concentrate on the beats of the pulse. So next one is taking the respiration rate. So still place your fingers on the individual's wrist and then start counting the breath. So inhale plus exhale is to one respiration for 1 minute. Do- don't forget to document respiration rate and take note of the wheezing sound or any sound that you might hear from your patient. And document. Okay, so the next one is to take the blood pressure using a stethoscope and the digital monitor. So make sure to wash your hands and disinfect the stethoscope and the earpieces and the diaphragm. We also have to make sure that the blood pressure monitor is in good working condition, and Make sure that your fingers are on the underside of the elbow to locate pulse, which we call the brachial pulse. Next is you turn on the power on the start to start the unit. On the automatic models, the cuff will inflate by itself with a push of a button. Next, after the cuff inflates, the automatic device will slowly let the air out. Look at the display screen to get your blood pressure reading. It will show your systolic and diastolic pressures. And don't forget to document and make sure to write the date, the time, and the device that you are using. If you need to repeat the measurement, make sure to wait until 2 to 3 minutes before you start again.